Treatment of hyperthermia in children. To treat high fever in infants, follow these initial steps. Lower the room temperature to 20 degrees Celsius. Take off all baby clothes and covers. Give the child fluids, especially water, in small amounts and frequently. Use cold compresses and put your child in a bath of cool water. Treatment of hyperthermia in children. High temperature between 37.5 to 39 degrees Celsius. Here are the details in the following. Steps for treating hyperthermia in children. To treat hyperthermia in children when it does not exceed 39 degrees Celsius, follow these steps. Make sure that the temperature of the room in which the child is located is not high above 20 degrees, and it is better that the room temperature be at a rate of 18 degrees with adequate ventilation. Take off all the child's clothes and covers and leave his cotton underwear, and you may have to remove them if the temperature exceeds 38 degrees Celsius. Start giving your child fluids to replace the portion of the sweat that accompanies the high temperature, and dehydration may be the cause of the high temperature. Always keep special fever-reducing medicines for children, but don't forget to check with your doctor before using them. Liquids that can be given to your child. Here you can give the following fluids to the child. Plain water comes first. Sugary liquids, such as sweetened natural fruit juice. Salty liquids such as vegetable soup, carrot soup, especially if there is diarrhea accompanying the high temperature. Milk is not given unless there is no diarrhea in the child. Tips for treating hyperthermia in children. We offer you a set of tips related to overheating here in the following. You must give him large amounts of fluids, even if they exceed his normal need. Do not wait for him to cry or be upset to give him an additional amount of fluids. These tips are very important, especially for a baby whose temperature may reach nearly 39 degrees, especially during the night, as we wait for the morning to present it to the doctor. You must monitor and measure the temperature periodically and regularly. If you get a decrease in it, this is a good thing, provided that you do not put blankets and clothes on the child directly. Wait until it stabilizes and this decrease continues, but if the temperature continues to rise, you will have to consult a doctor immediately. Treatment of hyperthermia in children. A fever exceeding 39 degrees Celsius. Here, the same principles mentioned in the previous case must be repeated, and during this period, you must prepare the water bath for your child, taking into account in following the following. How to prepare the bath for children. When preparing the bath for your child to treat hyperthermia, follow these steps. Use a regular plastic tub, which can be the same tub used for a baby shower. Set the water temperature to be 1 degree lower than the child's temperature. You can measure the water temperature with a medical thermometer used to measure the child's temperature. If the child's temperature is 40 degrees Celsius, the water temperature is 39 degrees, but if the temperature of the child is 39 degrees, so the temperature of the water is 38 degrees Celsius. Gradually submerge the baby in the water, starting with his feet, then his seat, then his torso, and then the rest of his body. You can use the same method used to bathe the baby. Put your child in the bathtub for 15 minutes, and you can put some toys for your child in the water until he passes this period without crying or screaming. Take your child out of the water, dry him well, and measure his temperature again. If it drops to 38 degrees, that's fine, but don't put his covers or clothes back on. We can put light cotton clothes on. The temperature has dropped only 1 degree. Continue the treatment with a new bath of water until its temperature is lower than the first by 1 degree and its duration is a little longer, about 20 minutes. The child's temperature drops to 37 degrees Celsius after the second bath, which is the required temperature, and then you can put some light cotton clothes. Important information about the baby bathtub. Here is a set of important information about the water bath used to treat hyperthermia in children as follows. The bath aims to reduce the temperature of the child, but slowly and very gently, so placing the child in colder water may cause chills in the child. It comes with the opposite result, raising the child's temperature. The water bath can be done if the temperature rises to 39 degrees Celsius, but you can do it at less than this temperature if the child is agitated and disturbed by his temperature to avoid convulsions accompanied by heat, which are movements of the hands and feet similar to epilepsy. The water bath can be done even if there is a cough or skin eruptions such as red bumps in the child. You will notice the recovery of your child and his return to his normal state thanks to this bath. In addition to the fact that the child loves to play in the water, we can say that the water bath refreshes the child while the heat dries him. Treatment of hyperthermia in children. What is the doctor's role? The role of the mother and father is to reduce the temperature of the child, which may be more harmful than the disease that causes it. It is preferable for the mother to use natural methods such as water baths, cold water compresses, and the rest of the methods mentioned to reduce the temperature. We advise parents not to use oral or rectal antipyretics before consulting a doctor, as they may lead to masking the symptoms of a fever-causing disease. The role of parents is to get rid of heat and its damage, while waiting for a doctor's consultation, who examines the child, detects the disease that causes the temperature and prescribes the appropriate treatment.